Okay. You're ready?
Mm-hmm.
Okay.
Okay. So, like I was saying, you want to go ahead and palpate the brachial pulse, which is all you have to do is on the humerus here, on the what would that be, the medial aspect of the humerus. You just go ahead and light pressure, and you should be able to feel it. That one's pretty easy to feel because there's not a whole lot of muscular material on the inside of the arm like that. Next one is going to be your radial pulse. Again, just like we were doing when we palpated the blood pressure. Okay, good. And then you go ahead and just lay back. The next couple that you're going to be palpating, it's going to be your femoral is the next one, and the femoral is usually high up in the pelvic region. Okay, so yeah, it's just about right in here. Now you don't have to. It's super difficult even on healthy people. So as long as you know the area where you're palpating, you should be good to go. Okay, next is going to be, and you can just go ahead and put your leg up a little bit, is going to be the popliteal, which is just behind the knee. Again, it's not an easy one to get, but as long as you know the general area. Then, obviously, you can have the patient take their shoe off. I'm not going to have you do that, but top of the foot, 2 fingers, usually where the ridge of the foot is, right in the middle, just off to the right of that, or just lateral, you can usually get that dorsal pedis. And then the last one is going to be the posterior tibialis, which is just behind the medial malleolus here. And that one again is, they're difficult to get. But as long as you know the area where you're looking for it. Oh, I got it actually. That's one of the feelings I got. All right, good to go. So, now we've palpated all the pulses. What we're going to do next is we're going to auscultate those pulses. So, much like how you did it with the heart, you're looking for any abnormalities as far as, they call it bruise, which is that rushing sound of blood due to either some sort of a constriction in that vascular area, which could indicate maybe some sort of thrombosis or blockage. So if you notice anything odd on palpation, one pulse is weaker than the next, or anything along those lines, it's a good idea to auscultate that same, but obviously for the PCL purposes, you're going to auscultate everything anyway. So go ahead and sit up for me real quick. I'm just going to push this in. Okay, so I'm not going to put this in my head because these things kill me, but yeah. Where you're going to auscultate first is going to be the temporal areas. Oh, and real quick note, palpating bilaterally. You're always checking bilaterally. Now, whether the instructor wants you to verbalize that or actually do it, one side then the other, this side, and some of them you can obviously, like your radial pulse, you can obviously check at the same time, but some of them you obviously have, don't ever check the carotid at the same time. So when you're auscultating the vessels, you're obviously going to start with your temporal, starting high, and it's just going to be in this area here, okay, and then obviously you'd work to the other side, then the carotid. And you use the bell because it takes away a lot of those high-pitched noises and it helps you hear just that blood rushing through that area, okay? Next is going to be the subclavian. So clavicle, clavian, subclavian, below the clavicle. Okay, good. And then next, you go ahead and lean back just a little bit for me. Oh yeah, lean back. Okay, so you're going to do renal and abdominal aortic next, okay? So renal is going to be pretty much just below the rib cage on both sides. I don't know how easy it is to hear, but it's a listening spot in the event. And then abdominal aortic is going to be right in the epigastric area, okay? Then you're going to do the iliac, which is going to be just, if you find the iliac crest, you're just going to listen just above the iliac crest, okay? And then lastly is going to be the femoral. So if you remember where the femoral pulse was, it's going to be in that same general area, okay? And those are all of the listening points working from head to toe, okay? And then the last part of the PCL, there's 5 questions that they're going to ask you. So my recommendation is go through them tonight, read them over, answer them, and then know exactly, kind of what they're looking for. I doubt they're going to ask you all 5, but at the same point, be ready for anything. All right? That should be it. Oh yeah, I'm sorry. Yeah. There's one last thing. Now it's not actually a test. You don't. I mean, in the I completely blanked out. So the last thing you're going to do is you're going to inspect for things like deep vein thrombosis. You're going to inspect for varicose veins, which could be another sign of obstruction. So it's the very last part after you auscultate. The one thing you do have to know is the Horner's test, okay? So what you're going to do is you're going to dorsiflex. You can just have them just a little bit. Dorsiflex the foot up, and then what you're going to do is you're going to apply deep pressure to the calf muscle, the gastrocnemius. And if this elicits pain in the patient, that's a positive for like deep vein thrombosis, okay? The other ones you're going to look for is obviously thrombosis, varicose veins, edema, and then the Horner's test. And that should be the last part of the PCL. I'm retarded, I almost forgot. So other than that, look at those 5 questions, run through the PCL. If you get stuck, go ahead and use the video. Good luck.